NHS planned care coming to a virtual standstill this week. Who said that? Well, Professor Sir Stephen Powis. He's warning of mass disruption across the NHS as consultants move to providing just emergency cover. As of 7 o'clock on Thursday until 7 o'clock on Saturday, consultant doctors and hospital-based dentists will be on strike. This follows, of course, junior doctors being on strike for 5 days up to yesterday. Let's talk to Stephen Dorrell, who's a former Conservative Health Secretary, about this. Good morning to you, Stephen.
Morning, Julia.
Thank you very much indeed for joining us. I mean, it's another day, another NHS strike, more cancelled operations. You know, things being moved. I mean, I was with an elderly relative yesterday, had an operation cancelled with the junior doctors' strike, and it's been moved to December. I mean, one operation treatment till December. You know, that's just how we live now. We just think this is normal. Routine care virtually at a standstill. I mean, we're paying, what, 40% of GDP? Of government spending on the health service, and we've got routine care at a standstill. What's the solution?
Well, the solution clearly has to be that that the government engages with the BMA to sort out what is a pay dispute. I think the government were right, to be fair to them. I'm not a supporter of this government anymore, but I think they were right to encourage or to welcome back the pay review body. I do think an independent review body looking at doctors and nurses and teachers and so on, looking at their pay and making recommendations to government. I think that's the right approach. It's what Margaret Thatcher set up actually in the 1980s. They've made a recommendation. I think what's regrettable is the tone in which the review body recommendations were announced, to say essentially take it or leave it. Well, this pay dispute's been going on since last autumn across the health service, not particularly the consultants, but the whole staff of the health service has been in pay dispute basically since last autumn. And the government really need to address seriously the question, not of how you pay 35% today. Nobody believes you should be doing that. But how you address the underlying concerns of pay and conditions within the health service for the people on whom we rely to deliver decent health care.
Well, I mean, this is the thing. Look, we know we need more nurses, more doctors, more everything in the NHS. What I can't understand is they've got loads more money, but they can't seem to find these people. And as we've seen with a lot of the pay, yes, you know, they're not earning. Most people working in the health service aren't earning a fortune, are they? But, you know, if you're a nurse, you're a junior doctor, you're earning, you know, above average income, and you're also getting, certainly in the case of doctors, you're getting 20% of your income paid in on top of your income as pension as well. I mean, I don't know anyone in the private sector who's got that. Well,
there are people in the private sector who've got that, as you know. But I don't think actually you solve a pay dispute in any organisation, in either the public or the private sector, by saying that you ought to be happy when you're not. What you have to do is to address concerns where people have concerns, whether they're working as as porters in the health service, as nurses in the health service, or as doctors, or as junior doctors, or as consultants. We all know that in order to recruit people into those jobs, there have to be jobs available on terms that people find acceptable. And just saying that people ought to be happy when they're not isn't addressing the question.
Indeed. Well, I mean, again, I just find it extraordinary these things haven't been resolved. But it's, you know, between 5 and 6% and 35% is a very large gap. Stephen Dorrell, always appreciate you joining us as a former Conservative Health Secretary. Thank you for that. 8:31 is the time.